Hi everyone and welcome to Imaging Experts Pakistan. In diagnostic imaging, there are different strength of magnetic field. It ranges from zero point 0.3 Tesla to 3 Tesla. And today we are going to discuss about the 1.5 and 3 Tesla and what are their differences. To discuss about this topic, we have got Mr. Julian Grejo. Hi Grejo
Hello.
and welcome to the Imaging Experts Pakistan.
Hi there, Motherboard. Hi, it's a pleasure being here.
Good. Julian, would you like to give your introduction to our listener, please?
Yes, of course. So my name is Julian Greggio. I'm a senior radiographer. I've recently relocated to UK, to be honest. While I had a past working in Italy as a radiographer, I always worked with 1.5 and 3 Tesla MRI with different vendors from GE to Siemens. So I had many details regarding different magnet system to compare and to try to share my knowledge with our listeners.
Let's start the topic. What are the main differences between 1.5 and 3 Tesla, basically?
Well, Madhur, I will probably start by saying that probably most companies in the healthcare field at a certain point in their history, they faced this sort of hesitation regarding the fact buying a 1.5 Tesla or a 3 Tesla system. There are many doubts, to be honest. There are pros and cons to consider. We know that 1.5 has long been the standard strike magnet used in the clinical setting, while 3 Tesla machine has been typically used in research setting. However, this pattern is quickly changing, as you probably know. Um, while the 1.5 is still widely considered state of art medical imaging, we need to say that 3T magnets are becoming much more common and accessible even outside the research setting. The reason behind this are multiple, but probably I would say that there are two key factors for this pattern. And one it is better imaging quality, and the other one it is faster scan speeds. About the first one, so we know that there have been lots of improvements in the 3T, especially regarding the SNR, the signal to noise ratio.
Yeah.
We need to consider the fact that the SNR in a 3 Tesla scanner is twice as sensitive compared to the 1.5. Improved SNR means higher spatial resolution and higher temporal resolution. So why this is important? Higher spatial resolution is essential to depict small lesions in complex anatomy, like for instance could be the labrum pathology for the hip or the shoulder. And also we need to consider another major benefit of 3 Tesla system, which is scanning more patients in the same amount of time required to the 1.5, preserving a similar imaging quality compared to the 1.5. And this is clearly an advantage that some businessmen needs to consider, because we know that more scans done per day means great revenue for the company in the long term. So this is another factor to consider. What do you think?
Yeah, with a good imaging quality as well, definitely. So, what are the other differences? Like, if we keeping the parameters in our mind, what are the
Yeah.
differences in 1.5 and 3 Tesla? For example, the value of the TR or T, are they
Yeah.
different?
So we know that TR and TE are basic pulse sequence parameter, and they stand for repetition time and echo time, and they are typically measured in milliseconds. The echo time represents the time from the center of the RF pulse to the center of the echo, while the repetition time is the length between corresponding consecutive points on repeating series of pulse and echoes. Differently, the time of inversion is something that predominantly characterizes a specific pulse sequence, which is the inversion recovery. We get a typical example with the stir sequence, which involves the suppression of the fat, and the flare sequence, which involves the suppression of the CSF. So for today, I have a table that I want to share with you. Okay, so as you can see, these are the typical values we were talking about: the repetition time, the echo time, and the time of inversion, mainly for T1 weighted sequences, T2 weighted, and PD weighted, stir and flare, so the sequence we were talking about. And they are different from 1.5 and 3 Tesla. So what we can say about this table is that there are no major differences regarding the T between 1.5 and 3 Tesla. It's roughly the same according to the weighting of the sequence. But there are some major differences as regarding the TR that must be considered, especially as regard T2 and proton density, stir as well. But the major difference is regarding the flare. So we see that there is a huge increase of the TR as regarding the 3 Tesla system. But in my opinion, and based on what have been my personal experience, the parameter that is is very important to consider, especially when we change from a scanner to another, is the time of inversion. As we see, it's not a big difference, but it must be appropriate selected. Otherwise, we will have a deficit in the saturation. Could be, for instance, of the fat in the stir, or could be, for instance, in the CSF, in the flare. We recently had a case that in our department, the protocol has been imported from the 1.5 system to the 3 Tesla system, same vendor, without adapting the time of inversion from 1.5 to 3 Tesla. And there was a visible deficit of saturation of the fat, which was not suppressed because the frequency was completely different, was set at 150. As we can see, 150 worked only for the 1.5. And probably I can also say that this parameter, to be honest, is not really accurate because nowadays, for what I see, radiologists prefer in 3 Tesla have time of inversion set over 200, so between 200 and 230, 240, so to have an appropriate saturation of the fat. And yes, so probably this is one of the factors that must be considered, especially when we import very easily protocol. This is a particular feature that comes easier nowadays, moving a protocol from one scanner to the other, especially when you have the same vendor but different magnetic strength in the same department.
So in short, if we talk about the TR in T1 and T2, what could be the range, and what are the different ranges in 1.5 and 3 Tesla?
So basically, as we see here, there is an average. However, probably I would have exceed for a T1 in the 1.5 700, and maybe this parameter can be exceeded in 3 Tesla, which could probably range from easily 600 to 1000. However, I would probably recommend to remain here as well at 700, because there is always the possibility to split with the concatenations. So we can try to split different TR in the same measurements, which allows us to preserve the weighting of the sequences. We got this possibility. So this can be applied to the T1, to the T2 as well, because especially for the 3 Tesla, T2 can reach very high values in terms of milliseconds. We can have T2 sequences that can easily reach like 8,000, 9,000, even more. So we don't want to have TR that are too high. So I would probably recommend to try to consider these average parameters and use concatenations to achieve the standards. Because we don't want, especially for T1, to approach close weighting like could be proton density.
Yeah.
As we can see, they have the same TE. So it's really important to try to avoid to have a more proton density weighting to try to maintain these parameters also using, as I was saying, concatenation.
Perfect. So we come to the applications now. What are the differences in applications and what are the new features in 3 Tesla and 1.5 Tesla?
So, as regards the new feature available, probably I will concentrate this conversation on parallel imaging, which I believe, in my personal opinion, it is a feature that is gathering popularity and will increasingly become important in the selection of which type of system to buy or to use in the future. So, we know that parallel imaging is really important to reduce the scan times. Of course, as we said, in MRI, there is always a trade-off. In fact, the reduction of the scan time is due to the increasing of parameters like grappa, sense, or arc. It changes based on different vendors. Is usually accompanied by a loss of signals. However, when these parameters is applied in a 3 Tesla system, despite a significant reduction of the scan time, the resulting image is usually comparable to the 1.5. And this is due to the abundance of signal that we have, the SNR, as we mentioned, that we have at 3 Tesla. So we need to consider the fact that new features regarding parallel imaging are more available on the market. There is literally a competition between the major vendors, GE, Philips, Siemens, to try to ensure the customer to have a tool that help to reduce the scan times, preserving a decent quality. A recent example of this is the simultaneous multi-slice feature developed by Siemens, the SMS, which as stated in their website, allows a cut of the MSK exams up to 46%, maintaining the same time more with a decent quality. I saw, for instance, a knee that could easily reach the quality of the 1.5 comparing, but was done in something like 1 minute per sequence, so which seems crazy in some departments. So in this sense, Motherboard probably, I think that vendors will probably continue to offer new feature to customers to try to improve the workflow in the department. But the question is, who ensures us that all this new feature will be available both in 1.5 and 3 Tesla? There may also be a scenario whereby only 3 Tesla system will be considered performing enough to satisfy new requirements of parallel imaging. This must be considered. What do you think?
Okay. And what about the safety issues in 3 Tesla? If we compare between 1.5 and 3 Tesla, what could be the safety issues while scanning the patient on 3D?
Well, let's get straight to the point. Patients who have implants or medical devices are safer in a 1.5 Tesla magnet. Not all objects are tested that are tested in a 1.5 are tested as well in the 3 Tesla MRI system. This is why most center, when there is a partial contraindication to the scan, like for instance, an hip replacement or an aortic valve, they opt to scan the patient in the safer machine, which, as we said, is the 1.5. However, nowadays, there are websites like MRI Safety, which is a sort of database that gather most of the metal hardware in the market, and it provides indication regarding their being compatible with MRI and at which magnetic field. This is very useful, especially for patients that needs to have the scan done in the 3 Tesla system. Most of the time, they also provide the SAR values to not exceed to ensure the patient to have a safe scan. Nevertheless, what I would like to tell is that sometimes this amount of information is not enough to preserve the patient's safety, especially in MRI. I mentioned hip replacement, and this is very important to me because I can bring my own experience. To be very honest, I saw many people scan patients with hip replacement in 3 Tesla without no issues occurred, but it's strictly related to the part of the body in examination. For instance, in the past, I naively performed a prostate MRI in a patient with bilateral hip replacement. And my only thought was to keep the SAR level at a reasonable level to try to preserve the safety, and I will explain also in which measure this can be done. But the fact is that the high power, the magnetic field, combined with sequences with high release of SAR, like for instance, turbospin echo, we know the prostate MRI is characterized by a lot of T2 weighting turbospin echo, which release high SAR values. So this combined, plus the fact that the patient had the bilateral surgery of the hip, create a sort of eating area around the area of examination, so around the lower back, the lower extremities as well. The skin of the patient was completely red. To be honest, he didn't squeeze the emergency buzzer, which allowed me to think that the patient was okay. But in the end of the scan, I mean, this area of eating was clearly visible. And I remember that the patient, after a couple of days, asked for compensation to the company because this particular fact was related to burning. So this is something to not underestimate it, especially when we scan patients with metal devices, metal hardware in a 3 Tesla. We always need to consider the benefit of having such a scan, or could this scan being done also in the 1.5? So yeah, this is the trade-off.
Okay. So about the SAR levels you have discussed. So what are the parameters, or how can we reduce the SAR levels in 3.5 3 Tesla?
Well, a very simple link to reduce the SAR level is taking breaks between high SAR sequences. I know that most of the times this is not possible, especially because the company asks us to perform as many scans as we can during the workday. However, we need to be aware of the fact that the patient safety comes first. So this option must be considered, especially between a lot of turbospin echo T2 weighting sequence, like, as we mentioned, the prostate. But there are also other useful links that can be acquired and that can be performed. Like, for instance, we can drop the flip angle and we can acquire sequences with low flip angle. And as well, we can also reducing the number of slices. We can try to reduce the pulse number and the duration, as well as reducing the frequency. So there are many tips, to be honest, that can be used to try to prevent the patient from being harmed when exposed to a 3 Tesla magnetic field. Also, vendors nowadays offer the possibility to decide before starting if use the normal mode or the first level, which already provide the user with a sort of indication about which will be the SAR levels used. So normal mode is always the best option to keep the SAR at a reasonable level, especially when we have patients with metal hardware implanted. So again, this is my personal experience, but I believe in the sense that Siemens is offering the user with valuable hints during the scan. I know that someone complained that there's conflicts that the Siemens provide during the scanning can gradually slow the entire scan time. However, there are simply alerts that suggest the user how to reduce the SAR, like we can lower the flip angle, we can reduce the amount of slices, and it's very important, as I said, to preserve the safety. I believe in the sense that all the other vendors should try to do steps to try in the same direction that Siemens did to try to ensure the safety, because to be honest, with other vendors, but this is just me, I didn't have the same possibilities to do that. Otherwise, possibly maybe this could have saved me the times that the patient had such problem during the prostate MRI, like offering solution to try to reduce the SAR values.
Whatever the manufacturer is, you can always, within the normal levels, you can always have the option to reduce your SAR level and scan the patient in low SAR. Thank you, Julian. Thanks for your time. And it's been a pleasure to have you at this platform. At the end, would you like to give any suggestion to our listener, to the radiographers, to the new or junior radiographers?
Well, yes, probably if you are asking if I probably recommend to buy or to use, is it better to use this? It's better to buy this 3 Tesla over 1.5. So probably my answer is to my colleagues is pretty disappointing because I'm pretty neutral regarding this topic. On the one hand, I recognize the fact that all the advantages that having a 3 Tesla machine can bring, like for instance, there are new technologies, as we said, there are new features in place, and that is the way to have faster scans preserving a decent quality. For some scans like the prostate, I think having a 3 Tesla MRI is essential because you want to avoid to have the endorectal coil that you probably used to achieve high SNR in 1.5, as well as probably neuro MRI, so the brain, the study of the brain, MRI, having 3 Tesla system can represent a huge step to increase the quality of scanning compared to the 1.5. However, we need to consider also a huge component, an important component, which is artifacts. The Tesla system are more prone to artifacts, to field or inhomogeneity, chemical shift, dielectric effects. So for instance, some radiologists prefer to have the female pelvis imaging done in the 1.5. And this is related to the fact that there are lots of artifacts and all the one I mentioned in scanning, imaging the patient, the pelvis in the 3 Tesla for the female. So again, it's difficult to say which one is good, which one is better than the other. For me, this absolutely changed also based on the vendor. I noticed a huge improvement from the 1.5 Tesla G to the 3 Tesla, which would probably make me say that the system is more user-friendly, more performing, there are lots of new features, but I didn't have the same impression for the Siemens. I didn't feel this huge gap between the ERA, for instance, and the Skyra. So again, this means that probably Siemens already had a good 1.5 in place. A solid machine like the ERA could be. So my suggestion for my colleagues are try to work as with many scanners as you can. Try to create your own thoughts about this. Could be absolutely important, especially because in the future, as I said, vendors are keep creating new ways to perform like fast scans. So you need to be aware of what's changing, what's going on.
Keep
Also
learning.
to try to draw your own thoughts regarding this topic.
Yeah, keep yourself up to date and keep learning. This is the best, I would say, suggestion to the dealer.
Yeah, absolutely.
Perfect. Thank you so much for your time, and we are going to end
Thank
this
you.
episode
Thank you,
here.
Madavar. Thank you so
You're
much.
welcome. And we are going to end the episode here, and we'll see you in the next episode. Thank you.